Substances and Disease Registry. That's part of the Centers for Disease Control, federal agency. A Long Island resident submitted a petition to ATSDR, and we work with ATSDR. We have a cooperative agreement with them. The petition was basically that question: what, if any, adverse health effects have residents suffered due to the contamination? Primarily that's in the water. That document is still, actually it's in final review right now. I don't know exactly when it's going to be ready. I suspect before the end of the year, I hope. It's very frustrating because I've been working on it for a number of years now. Bureaucracy or the procedures that we need to go through to get this document approved is taking a lot longer than I would have hoped. So there will be something coming soon about, again, the potential adverse health effects, if any, that people may have suffered due to drinking the water. And primarily we're talking about drinking the water before all these treatment systems went in on the public water supply well, as John was describing to you. And that was...
what about the air and the soil we were exposed to?
Well...
for years.
For years, when the
many
plant
years
was in operation?
No, for the park that sat with contaminated soil for many, many years before it was remediated, and then you have the air that came off of that, the air that you found in basements of homes, et cetera, et cetera, et cetera.
Well, the park itself, even though that contamination was there, it's been... The question was, what about exposure to air and soil, I guess, basically.
Yeah.
And specifically in the park itself, right?
And the surrounding areas,
in
correct.
The surrounding area. The park itself, even though we know there's contamination underneath it, there's I don't know what the thickness of the layer of clean soil over top of the contamination is. So and again, we've been involved in this project. The Department of Health has been involved for a long time, and we've evaluated the conditions of the soil at the surface where people could possibly come in contact with contamination, and there essentially wasn't any. And there's not going to be any exposure to air from that contamination either, because it's been underground. I mean, that's the simple kind of explanation.